Hey, it's a great day at the Huda. How may I help you? Yes, you'd like to make an appointment? All right, great. Our first available appointment would be October the 22nd. That's a Saturday. Is that good for you?
We formed the Huda Clinic as a continued outreach. We see it as being established by the Muslim community as an outreach for our charitable giving, our charitable work. We felt like we had so many doctors who were Muslim that it was just a natural fit for us to come together and try to provide free health care to the uninsured in the Metro Detroit area.
In this clinic, we are blessed by the help of so many volunteer physicians, as you can see. This is Dr. Layla. She's an OBGYN from her country, which is Bangladesh, and she's migrated to the United States. She's in the process of passing her boards, but she's been a great asset and help to us. She's here every Saturday and almost every Wednesday. She's seeing patients. She's our female physician who's constant, so she's doing the female examinations. And our largest minority, we see a lot of Bengali patients from Hamtramck and other areas of Detroit who don't even speak English. So she's our resource on that. She's our interpreter. She's seeing those patients, and she's here all the time. So I'm greatly indebted to this lady.
Thank you very much, doctor. Thanks a lot.
No, she's wonderful.
Thanks a lot. Thank you.
Can you just lean forward a little bit? Push your chair up a little bit. Take a deep breath. So unfortunately, we are not doing labs right now. You want to come back next month, and hopefully we'll have something. Okay?
Next month.
Yeah. So you can give him hydrochlorothiazide, 30 tablets. Yeah.
Okay.
All right, man. Take care.
All right.
I'm a hospitalist at St. John facility. I've been volunteering with the Huda Clinic for almost 2 years now, and it gives me a great pleasure to volunteer and come here and serve the indigenous population of Detroit. We see a lot of patients here from different communities, African American, Bangladeshis, and people from Bosnia, all over, the people who live around here. And we try to help them, give them the basic medical evaluation, and give them what basic medications we have here.
Take a deep breath. She's wheezing.
The most common conditions we treat here are high blood pressure, diabetes, and infections, acute infections. And we try to give them some referrals somewhere, whatever we can.
Yeah, I'll give her. She needs to be on some prescription. Yeah.
Okay, no more than 12 grams a day of Tylenol.
Yeah.
As Muslims, we're taught to, help out our neighbors regardless of where they're from or who they are. So this clinic is kind of a representation of the Islamic ideal of what Muslims should be doing for their community.
So I'm just tired of it just hurting.
Okay. So as a medical student who's almost finished, I'm going to enter residency, and soon enough I'll become a doctor. And doctors have a special place in the community with power, influence. Doctors are people that are entrusted with caring for the community. And I think it's important to use that position for good.
And we do receive clients from the entire metro area, so that we have folks from Macomb County and Oakland County. That includes the homeless, but it also includes the working poor, those who have jobs that are not being provided health care coverage. Then they are considered uninsured, and we're here to help.
This is our second time coming to the Huda Clinic, and it's been very helpful, especially since my husband and I, we don't have any insurance.
So we come here, we sign in, we don't have to wait very long, we get to be seen by a doctor. They're very friendly, very nice, always efficient, and trying to help you out as much as possible.
Doctors are very engaging and they take the time to get to know you and what your needs are going to be.
Every piece of equipment that you see at the Huda Clinic, including the medications, the lab coats, are donated by the physicians and alike. It's a dire endeavor that we've taken upon ourselves, and we're growing. In fact, we've just grown so much that we've purchased a building across the street, an old abandoned church, and now we're going to turn that into a new clinic with over 6 exam rooms, large waiting room. Usually on Wednesdays and Saturdays, we get patients in here at a range of 50 to 100 per day.
Good morning. Please join me in there in room 1. Okay.
We try to manage that with whatever funds we have, but by the blessing of God, we're still able to do it, and we're expanding at a rate. And it is a beautiful thing that more physicians are coming in, and more physicians are learning about the Huda Clinic. Because of that, we're becoming more renowned, and we're getting more donations. Donations not money-wise, but medicine-wise. Blood pressure cuffs, Band-Aids, syringes, anything that you can think of that would have in a hospital or an ER, they tend to give it to us here. Funds are still short, but we're still making ends meet.